All right. Well, thank you all for coming. We're going to go ahead and get started and get on our way here. So I'm Dr. Joanne Yanez. I'm the Executive Director for ANMC. And before we get going, there's just a little bit of an intro here. So everyone should be in listen only for now. And if you do have questions for any of the sites that are present, we actually encourage you can instant chat them while we're talking and while we're going through things. So for the presenters, please be sure to keep your messaging open so that you can see if there are any messages coming into you while we are speaking. So with that, if there are any questions, if you have anything that comes along the way, please email events@ANMC and hopefully we'll be able to get you a response. So this is just an informational purpose only and not eligible for CE. We also ask that it's not reproduced. We will be providing a recording at the end of this for folks who were not able to attend. And so with us today, we've got a number of folks. Actually, Dr. Vasquez will be joining us on the 7th for Sonoran University. Everyone else here from the residency committee is present today and available to answer any questions you may have about the process. So really just, we're going to be covering brief timeline reminder, and then we're going to jump right into what you're here for, which are the site presentations. So Dr. Saunders, I believe this was you.
I think this one might have been Dr. Carino, but maybe I got mine mixed up. I will do the timeline though. So we had a webinar a few weeks back that is posted on the ANMC's website that you can watch the recording. And it briefly described or in depth described phase 1 and phase 2. Phase 1 is this time right now that we are gearing up to before the applications are actually posted. That's why you're here today. You want to learn more information. On the next slide, we'll discuss all the things you can do during each one of these phases. This timeline is also on the portal homepage. It is incredibly important to get all of these dates in your computer or in your calendar so that you don't miss them, because those will hold you back, certainly. So get these dates in, and if you need them again, I know Dr. Yanez is going to send this out afterwards, or you can find these dates on the ANMC application portal. Thank you.
Thanks. Okay, next.
All right, so I can take this one on. Thank you, Dr. Saunders. So then what is the process of application? Once again, encourage you to please go into the portal. All of the details are there, as well as we have all of the information sessions that are available for you as time proceeds, but also there are videos as well as information that is there. But the first important thing is to make sure that you have a profile on the residency portal, and that way you'll be able to get access to all of the different sites that are available. So please check that out. You'll also need to and want to prepare documents and evaluations. There are some things that need to be done by February, but there's a lot of information that you can gather between now and then. Some of it would be, for instance, to speak to some of your faculty supervisors who may be willing to be your references. So you may want to speak to them. You may want to get your CV ready, as well as have an opportunity to go do some preceptors and investigate the different kinds of sites that are available. The other thing that you need to do is make sure you register your credit card. So you have a lot of things that you can do between now and January, because starting in February, things happen fast. That's when an influx of folks are going to want to get all of their information together. And that's when the application submissions happen rather quickly. So get as much as you can get done. And then there's a schedule of the interviews, which you will be able to do starting approximately March, April. The actual timeline, as mentioned by Dr. Saunders, is listed there. And then there's the match results. So time runs quickly, so make sure you get some of this done quite quickly. So thanks very much.
So the sites that we're going to have today that you will have the chance to meet are on this slide. I'm not going to read them all out for you. I'll save you that. However, if you have any questions during the course of presentations, please do, if you've come in late, feel free to direct chat with the sites. I've asked that they all put their site name in with their life name, and this way you know who you're trying to communicate with. So that will be a little helpful tip for you as you're going through. If you really just want to ask a question of one or two sites, you don't necessarily need to wait until the very end. So just please note that as we go on. And so that I've already shared that. So with that, we will start with Hao.
Hi, I'm Edie Vickers. Hope you can hear me. I'm part of Hao Natural Healthcare Clinic. I have been the clinic director there since 1987. So I've had residents since 1999, sometimes one resident, sometimes two residents. I am a dually licensed, so I'm an acupuncturist and a naturopathic physician. We see a lot of complex patients. I'm part of the Institute for Traditional Medicine, which is a 501(c). So we're a nonprofit clinic, and you would work in two clinics. One would be in the main clinic on Lovejoy in Portland, Oregon. And the other is our nonprofit adjunctive cancer clinic, which is over in Southeast Portland. And that clinic has been running for the last 32 years. And there we see people going through chemotherapy, radiation, surgery, just dealing with cancer therapy. In my main clinic, we see many various people, from people with MCAS, people with mold, people wanting to do pelvic floor work, GYN, autoimmune, digestive health. So a wide variety of patients, a full spectrum. I think, why should you choose my residency? I have a lot of complex patients. There's a lot of hands-on. We do a lot of primary care along with injection therapy, perineural injection therapy, neural therapy, prolotherapy, and a lot of physical medicine. I think that there's a lot of one-to-one. We meet every other week on Thursday for an hour and every other week on Wednesday for an hour. So there's a lot of time to discuss cases and a lot of time to explore new treatment modalities. So please come and visit us. Thank you.
Thank you so much for your presentation. Let's hear from our friends at Champlain Center for Natural Medicine.
Hi, yes, that is me. My name is Amanda Daniela Garcia. I am a naturopathic doctor here in Vermont, and I'm a second-year resident. So I'm representing my clinic, Champlain Center for Natural Medicine. You'll see that by my name it says CCNM. I graduated from the Canadian College of Naturopathic Medicine, but this clinic also has the same abbreviation. How you doing, Dr. Carino? Also, just to get a little bit of interaction here, anybody from CCNM or considering coming to Vermont for residency, drop in a chat or put a reaction so I can just get a sense of who I'm really talking to. I'll give y'all a second. Be like, oh, me, I'm considering Vermont, or no, I could be convinced. Okay, no problem. So I was born and raised in New York. I came to Vermont. Big thing for me was just being close to New York, being close to family. So having been in your shoes about a year ago, I would really stress, like, what are your considerations? What are the big pieces that are gonna move you forward to choosing a residency? One of mine was location. So other considerations that I have on this little chart, if you're considering Vermont, it's on the East Coast. And I was in Canada for a minute, right? And Vermont, even though it's not too far away, it gets dark in the winter. Okay, y'all, this winter is black. And so if you tend to be a seasonal depression person, you know, you're gonna have to up that vitamin D over here, something to consider. If you're into snow sports, this is your place. Everybody loves to snowboard, everybody loves to ski, ice skating, you name it. I'm not into any of that, but I'm finding my place. Other things with Vermont, going down the line, insurance. which is really, really dope in terms of our scope of practice here. We can accept insurance. Insurances that range from Medicaid, Aetna, Cigna, MVP, Blue Cross Blue Shield. Those are all of them that I'm credentialed with right now. Maybe there's a few of them I don't know of. Unfortunately, we can't accept Medicare. That's for people over the age of 65. So a lot of those patients tend to be self-pay. Now, a big piece when I say to consider this is when you're accepting insurance, you're playing, for lack of a better term, the insurance game. So you have to figure out medical coding. How do you build this? How do you chart this? And so it's very much a learning curve. I'm very fortunate that the clinic that I'm in right now, they've been doing this for a really long time. And so they're familiar with how to do this well and how to teach people how to do it. And so that's one piece. Of course, we have some self-pay people, but I think a really cool thing about being at this clinic is that you get to provide naturopathic care to people who maybe would otherwise not be able to afford it. Going down the line.
I'm sorry, Dr. Garcia, we have to keep to time so that everybody gets in, please.
Oh, yeah. Is it already 4 minutes?
We're just about at 3.
Oh, okay. All right. Real quick, y'all then. All right. Hit me up if you want any more information, because I can go on about this and give you really a holistic view of why you're considering this spot. Now, pharmaceuticals, we can prescribe basically everything under the sun. Except for like really high dose opioids, you have to take certain courses with your DEA license. Something to consider, especially with natural medicine, of course, like nature cure. But when you're giving patients care who can afford it, you're gonna have to do the antibiotic, do the antidepressant, do the anxiolytic. We also do IV therapy, high dose vitamin C. I did my first iron infusion last week. Also do glutathione and some B12 injections. And this last arrow, I really want to name, when you're doing residency, you're learning new protocols, there's going to be paperwork, whether it's prior authorizations, disability paperwork, wellness forms. A lot of it is learning the lay of the land. And when you first get licensed, you're like, oh, I'm just going to be seeing patients. Something to remind yourself about. All right, last slide, I think. All right, big things. We're looking for people who really want to communicate. Step into curiosity, be collaborative, always ask for help, ask for how other people are doing it. Everyone's going to practice differently. And I think that's really special about our medicine. And then empathetic, you got to meet people where they're at. Sometimes you just got to hear about what they're going through and to validate their feelings and then give them the resources that they need. Oh, chat is disabled. Oh, I know that. But yeah, if you have any questions about Vermont and working an insurance-based model, definitely reach out. Really, we see a lot of primary care, which is exciting. Some complex cases, but if primary care is your bread and butter, definitely talk to me. All right. Thank you for your time, y'all.
Awesome. Love Vermont. Also love TikTok. Actually, one of our residents, fun fact, has 100,000 followers on TikTok. She's amazing. And we get phone calls like for the TikTok doctor, which is pretty cool. If you look at this picture, she's up to my left at my 10 o'clock. That's Dr. Gonzalez. And she's amazing. So my name is Dr. Lauren Young. I'm from also the East Coast in the Northeast here, in Connecticut, not too far of a drive from Vermont if you ever want to visit. We also have a unique scope of practice where we are covered by insurance, able to order labs, imaging, but it is limited to a non-prescriptive scope of practice. What makes our location unique is that we are working alongside, actually this is dated, I just signed another doc. So we have 3 family medicine primary care doctors, 2 APRNs, and then 11 naturopathic physicians over several areas in Connecticut. Our main hub is 20 minutes east of Hartford. And typically we have the resident mostly out of that office, although depending on where you land, if you're closer to New York or if you're closer to Massachusetts, we may let you have a different main hub. So can we go to the next slide? Sorry, I don't know how to move the slides along. All right, cool. So our residency has been around for a while. Unique things that have to do with us. In 2018, our local hospital actually changed the bylaws and brought us on as medical staff. So there are 6 of the naturopathic physicians that do rotations and rounds at the hospital, doing consults. And what that affords us is this great relationship with many specialists. So we make sure that our residents are able to do some rotations in the community, seeing things that you wouldn't otherwise get to see as a naturopath once you're kind of in practice. So this is Dr. Gonzalez, our TikTok doctor. She is here with Dr. Rubino, who is a general surgeon. We also get to rotate with midwives, cardiologists, GI, you name it. If you have a specialty or interest, we can definitely work with the specialist from the hospital to kind of get you in those spaces. Because we have so many docs, typically we do grand rounds once a month where we all kind of pick a topic or go over cases together, kind of come together with a meal and go over things. Sometimes we have a guest speaker come in and do lectures. Typically the resident is expected to do case reviews here and also kind of present on different topics. Along with that, so these are the goal for the resident would be that you'd be able to shadow some of the doctors in the clinic and then have your own patient base as well. Kind of learning the ropes of, like you said, Dr. Garcia, like taking insurance, the flow of the seeing patients, that type of thing. Next slide. We also really want to advocate for being in the community overall. So last year we did a podcast as a group, pretty fun. We participate in health fairs. We are active with both community CME with the hospital, but then also our local association. Typically we all do a retreat in May. So the idea is that you're not alone as a naturopath, that you're in with a community. So that's really important to us, that you're doing lectures and doing those things in the community as well as the professional community. So this would be some of the expectations as well. You're never doing it alone. As a resident, you're always with somebody else. So we're all working together as a team. I'll be at the health fair just as much as any of my associates or residents. Next slide. One of the cool things that with our clinic is the number of modalities, right? So 11 naturopaths, as we've talked about, stray cats are all over the place. We have many different specialties. We have some that are more into oncology, some more into tick-borne disease, some endocrinology, and then with that, a myriad of modalities. Having osteopaths, medical doctors, and APRNs, even though our scope is limited, you are able to then study and learn about IV nutrients, PRP, all the cool modalities that that we know are so beneficial. So really, when you come into our residency, we are going to tailor it to the goals that you want to, what do you want to learn? How do we want to develop you as a clinician? What are your passions and interests? Or are you kind of just going to wanting a little taste of everything and finding your place? We will really tailor it to you. There are many of the doctors in the clinic are happy to have a resident be under them or working closely with them. So you can kind of pick and choose like how you want to develop it. So really, while we've been around for a few years, no single residency has looked the same because we really tailor it to the goals of the resident, which has been really fun. I think maybe there's one more slide. I had to cut them short. Nope. Great. Right back on to Fern Valley. So awesome.
Thank you so much, Dr. Young.
Yeah, absolutely. Thanks so much. If you guys have any questions, send the chat over my way. Take care.
Hey, Doctor. Thank you so much. Fern Valley.
Hi, I'm Dr. Lauren Riccio. I'm a naturopathic doctor and licensed midwife. I'm the owner and clinical director of Fern Valley Natural Health, which is in Bellevue, Washington, just outside of Seattle. I've been practicing, you can go ahead to the next slide. I guess, do I advance them or do you? There we go. Great, thank you. So I've been practicing for over 20 years and training residents since 2017. And Fern Valley is a founding member of the NUNM Residency Consortium, which provides increased opportunities for continuing education and resources for learning from other member clinics, which are spread out throughout the country. You can go ahead to the next slide, please. Great. So we are an insurance-based practice. We're contracted with most insurances, including Medicaid. We do see a large population of people with Medicaid insurance. We are a primary care family practice and see roughly about 50-60% pediatrics. So if you are interested in seeing kids, this is a great opportunity to do that. We also see babies, so right from newborn. We're having slide issues. Great, thank you. So right from day one, sometimes we're seeing newborns. We're also working on issues related to fertility and contraceptive care, including placement of IUDs and Nexplanons as well. We serve a diverse population and really believe strongly in access to care. And so we work really closely with our families with trying to find resources locally, as well as working on what their insurance benefits are to be able to provide them with resources. We are 5 doctors, 5 naturopathic doctors, 1 acupuncturist, and 2 lactation consultants. The lactation consultants specialize in feeding and oral motor function, and so we work collaboratively with the families and the lactation consultants, which is pretty awesome. We are looking for someone who's interested in a 2-year residency, who's interested and eager to work with kids of all ages and their families. The hours are Monday through Friday with about 30 to 32 hours of direct patient care. You'll start with shadowing and learning our systems and our local resources, but then we'll become busy seeing your own patients with likely roughly about 10, 12 patient contacts a day once you're kind of getting up to full speed. We provide a collaborative care model, and lots of our doctors will be seeing different family members. So sometimes, like, our lactation consultants may be working with babies on feeding issues, and one of our doctors may be seeing the parents for other health-related issues. And so we will kind of get together and talk about the care for the family and how to approach care to be able to provide them the best that we can. We will also do case discussions weekly. So we have meetings weekly where we'll discuss cases, and this is a great opportunity for any sort of mentoring needs as well. I am always available, and you also have the opportunity to rotate with other providers in the clinic and learn from them as well. We also have a full dispensary, including tinctures, and so we do lots of custom tincture formulation. We have access to lots of different subscription databases, so you've got access to as much information as you can need. Our administrative team will provide you with all the insurance contracting and billing, so you don't have to worry about that, and you can put your focus on your patient care. We'd love to have people, you could go ahead to the next slide. We'd love to have people come out and visit us. And if you have any questions, don't hesitate to reach out. But if you're interested in seeing kids, we're a great spot for that.
Thank you so much, Dr. Riccio. We'll go to the next slide. Okay.
Hi, thank you. Hi, I'm Dr. Heather Krebsbach with Intergate Health and Wellness Clinic in Portland, Oregon. Intergate is a multidisciplinary clinic offering our patients comprehensive care through naturopathic medicine, acupuncture, chiropractic, and massage therapy. The 2-year residency position is designed for naturopathic standalone or dual degree practitioners. Our residents can expect to treat a wide array of patients with complex conditions such as MCAS, hypermobility, SIBO, infertility, cancer, as well as a spectrum of digestive and hormonal imbalances. The resident will also have the opportunity to observe and learn prolotherapy, perineural injections, and vitamin IV therapy. Next slide. Is the next slide. Thank you. Thank you. A typical week in the life will include 1 day of observation with me and 4 days per week treating patients at the clinic. The resident will start treating patients on day 1 with daily guidance and support from me. Additional mentorship has been established and set up as external rotations with various MDs and nurse practitioners within the Portland community. Next slide. Throughout the 2-year residency program, the resident and I will be working closely together to discuss cases, treatment plans, to offer our patients individualized care. My goal is to help the residents succeed in enhancing their clinical skills and comfort with patient care. Next slide. So the best fit for our residency program is a graduate who is highly motivated, organized, has good time management skills, and one who works really well in a team setting, since we like to refer to each other within the clinic. You can read more about the residency salary, benefits package, along with the daily resident schedule in the posted job description. And please chat with me or feel free to reach out to the clinic if you have more questions or if you'd like to preceptor. Thanks for your time.
Thank you so much. Okay.
Good morning, everyone. I am Dr. Kristen Bishop. I host a residency site in Arizona We currently have 3 clinics, one in Mesa, that's our main clinic, one in Chandler, Arizona, and one in Phoenix. We serve about 3,000 patients currently. And I right now have my 16th resident, so we've been doing this a while as well. Next slide, please. We do direct primary care, so we do not take any insurance. We're all cash-based, which makes it nice, as some of the prior speakers have alluded to. You know, insurance brings, it has its pros and cons, right? But it brings a host of things that you have to worry about that we don't need to worry about, which I appreciate. We're continuing to grow. We currently have 15 naturopathic physicians in our 3 locations. Like I said, we serve about 3,000 people currently, and the clinic was started in 2011. We also do a lot of community things. That's a big thing to us. That's why we kind of have our tagline is we exist to serve. That's kind of our motto and how we go about medicine. Next slide, please. So what to expect? Our residency is very hands-on and autonomous. The residents meet with me every morning for case review, and then we give you your own patient panel. So I know some of the first-year residents are more scribe-based or shadowing experience. Ours is, we throw you kind of right in. You'll work up to about 12 to 18 visits per day. We do still offer 30-minute follow-ups and 1-hour new patient visits, but it's pretty fast-paced. We have a very collaborative team. We have like separate team areas that all the doctors work out of. So even in between patients, we're always collaborating on patient care. It's a supportive environment with a lot of support staff, from MAs to front desk people. We offer competitive pay, and something that also is somewhat unique to our residency program is we try to really offer it as a career path to staying on with us afterward. We like people who are looking for something more long-term. A lot of leadership opportunities as well. Most of our physicians are pretty active in either advocacy or our state associations, the AAMP. Those types of things are also very important to us. Next slide. So for more information, you can scan this QR code. It'll get you kind of the job description, what we offer as pay, that type of thing as well. Thank you so much for being here.
Thank you so much. Next, Natural Medicine of Seattle.
Sorry about that. Hi, my name is Anne Marie, and I'm the clinic manager at Natural Medicine of Seattle. We're located in just a little bit north of Seattle. It's a nice area. Our owner is Dr. Margie Akeda. She's been practicing in the area for over 15 years, and we have been doing residencies for about 11 years now, so we're real established. Next slide, please. A little bit more about our doctor, about our clinic, is that we're kind of a mid-sized clinic. We have 7 doctors. They all kind of specialize in different areas. We definitely see more of a teen to adult base. So if that's your area of focus, we see a lot of that, usually focusing more around 20s to 40s. So a lot of our population, and then a lot of older patients too. So we do primary care. Each of the doctors, it's a unique experience because we have doctors that focus on men's, women's health, hormones, regenerative medicine, natural aesthetics, reproductive health. So you get a lot of diversity within the doctors. And we also do a lot of different types of procedures as well. So we have IV therapy, we have skin allergy testing, we do pellet therapy, regenerative injections, shockwave, and we also do a lot of laser services as well. And the best thing about our clinic is that we're really a very supportive team-based atmosphere. So we're a mid-sized clinic, but we really are connected. We support each other constantly, and every single time that I interview one of our residents of what worked in the residency, they're always saying that the team-based supportive atmosphere is something that is just really needed. We definitely will help you develop your clinical skills and judgment and increase your confidence as a practitioner, and also just learn how to address the complex cases. We have a lot of complex cases that come through our clinics. We do some primary care, but really we're focused on more of the complex cases. You're going to strengthen all around your medical, your naturopathic modalities. and just really understand how we're going to be focusing on how to dive into your personal limitations and how to expand on that and make that better. A little bit about our clinic too is that we do a very comprehensive benefits package. We do vacation, we have life insurance, 401ks, continuing education benefits. Also, we just want you to make sure that you're your best self. So we do focus on like about a 40 to 45 hour week schedule. It's Monday through Friday. We understand that you need to be well balanced so you can be there for your patients. What we're looking for is a resident that is going to be doing at least a 2-year residency. Like some of the other clinics, we do offer a path to stay on with the clinic. It's a really great opportunity that we're going to be building up your practice and helping you with that. And really the best way to get to know your clinic, if you're looking for a clinic that you're working with adult-based, primary care, working with some specialties, and if that's what you're looking for, please reach out to us. Our email's there. And also, so go ahead, reach out and chat with us. Thank you.
Thank you so much.
Good morning, everybody. I'm Dr. Catherine Lara here on behalf of Dr. David Chang. The clinic that the residency is going to be for is Open Wellness. We're located in North Portland, and this residency is a 2-year residency. It is a residency that is focused on dual license ND LAC candidates, and it's a sports medicine pain management focused residency. There's a lot of regenerative injection therapy, so like PRP, prolotherapy, neural therapy, some stem cell, and a lot of MSK ultrasound, because the injections, a lot of them are guided with MSK ultrasound. And then there is some general naturopathic care that we do, but it's not necessarily a residency that has a whole lot of primary care. In this clinic, you work in a collaborative setting and an integrative environment with other doctors, with PTs, chiros that we have in office. Dr. Chang believes in collaborative care to improve patient outcomes. And so that's something that's really special about this clinic, is that there is true collaboration with other practitioners in order for patients to, get better, not only in the short term, but also in the long term. And then in addition to that, there's both internal and external rotations during the residency. And a lot of them are going to be, what you're interested in. In addition to lots of support, there is also lots of freedom in this residency. The emphasis is lots and lots of direct patient care and hands-on learning. Straight off of first week of residency, you're already seeing your own patients. And at the end of residency, you will be prepared to take on any challenges with a private practice setting, because Dr. Chang makes sure that he's preparing you for your future private practice, in terms of not only patient management, but also the business aspect of things, the insurance billing and coding, and then networking opportunities. He makes sure that you start refining your networking skills from year 1. And then in terms of freedom, or other aspects of freedom, is that you control your own treatment plans and your patient interactions, and you get to control what supplements or what herbs, lifestyle interventions, and non-controlled substances that you want to prescribe. He's really open to, listening to your perspective on each case. So there is, at the end of the residency, you will have enough patients to start your own practice. You spend the 2 years of residency building the foundation for the business that you will be running in the long future. And all the patients that you get to establish, that they establish with you in Open Wellness, they are yours after residency, and they get to follow you. There's no, non-compete clauses. And in general, Dr. Chang, and the goal of the clinic is to grow providers to be successful long into the future. And there's, enough sick people out there for all of us to have thriving practice. And he is there to support you any way that he can. And in terms of mentorship, there is 1 hour of mentorship that is dedicated to you every week for your learning. Thanks.
Thank you so much. Hey, next site.
Hi, this is Dr. Werner Vosler from St. George, Utah. Restore BioClinic is a destination clinic model for people with hard to treat, stuck chronic conditions. We primarily focus on patients with environmentally acquired conditions, Lyme disease, fibromyalgia, chronic fatigue syndrome. We see a decent amount of long COVID and vaccine injuries at this stage. We also see a reasonable amount of neurodegenerative conditions. We're a nationwide destination model. So this is not the primary care model. We do not do primary care unless it is somebody that is currently in active treatment. The clinic cycle is on typically Mondays. Patients, typically on Mondays, patients enter the clinic from wherever they've traveled from. And we do an intake at the same time that we start with a cell biology epigenetic focused treatment to, instead of, for example, with Lyme patients, offering them more and more progressively more toxic and complex antibiotic protocols, we focus on the cell biology component, which ultimately leads to the body regaining the ability to get the upper hand as you undo the epigenetic negative impact of environmental toxins, diet, lack of sleep, chronic stress, chronic pain, etc. So it's a Monday to Friday position. We anticipate, next slide, please. We anticipate typically about 40 plus hours per week. There's a lot to learn. So again, if you are somebody that is motivated to get a leg up on this incredible change in healthcare that we've seen in the past 10 to 20 years, where there's newer conditions that just does not fit into the old diagnostic model, this is an incredible learning opportunity for you. I must admit, it is very hard work, even though we typically see 6 to 8 patients per day for the entire clinic team, which includes 2 IV nurses, 2 colonic hydrotherapists. It is a low volume, very high intensity, very high quality of attention to details care model. So this is a fantastic area to live. We've got incredible sunshine. We've got basically 2 seasons with a short, beautiful spring and beautiful autumn. And we offer a very competitive package. We're a little bit out of the way, but again, we're in one of the most incredible parts of the country. If there's any further inquiries, please contact Maria. You can see her email down below, and also the clinic telephone number and website is over there. Next slide, please. That's it. Thank you so much.
Thank you. Seattle Integrative Oncology, please.
Hi, everyone. I'm not sure if you can see me, Joanne. I can still see you. My name is Erica Joseph. I'm a naturopathic physician and acupuncturist. I'm representing Seattle Integrative Oncology. We offer a 2-year naturopathic oncology hospital-based residency. We have 3 practice locations, a private practice in Seattle, and 2 hospital-based locations, one in Everett and one in Olympia. We are credentialed and on staff with both of these hospitals, so I have a very close working relationship with them. We started our residency program in 2014, and we follow a very close curriculum that was put together by ABNO and worked on by Dr. Chad Eshton, who started the residency program. We have ample rotation opportunities with radiology, pathology, surgical oncology, radiation oncology, gynecological oncology, and medical oncology. So we really do emphasize a very integrative approach with conventional medicine. We interface with our conventional medical colleagues on a sometimes daily to weekly basis. We participate in Cancer Conference and Tumor Board. We also enjoy many referrals from those providers and have a very collaborative relationship with them. So this is the 6 of us. 2 of us are duly licensed, myself and Dr. Harrigan. We have multiple staff members in our Seattle location. We also have dedicated staff at each of our hospital-based locations. We are one of the first naturopathic oncology programs in the Pacific Northwest. We're very active within our specialty organization. I was president of the OncAMP, vice president on the conference content committee. Dr. Bailey is a member of the ABNO board, a member of the WAMP. Dr. Eshton has been chair of the Washington State Board of Naturopathy for many years and also a member of AAMP as treasurer. Great. So just a little bit about what it looks like kind of week to week as a resident. Our didactic time is spent on Mondays, typically 2 to 3 hours, and then about 6 to 8 hours of self-study, which we sort of direct the student or the resident based off of the curriculum. We have very busy clinic days. We see patients typically Tuesday through Friday. We don't see patients actively on Saturdays and Sundays, but there's still a lot of self-work that's done on those days. Our didactic time is spent kind of reviewing the upcoming week, working on different administrative items, and then also a lot of discussion about specific cancer types and treatments. So the resident is incredibly well versed in different conventional treatment protocols. First year resident will typically see, I would say actually probably closer to 40 to 50 patients a week. Our practice has become even busier, I think, since we put together these slides. We are pretty exclusively oncology focused, so 90 to 95% of our patient cases, those individuals have an active cancer diagnosis, a personal history of cancer, perhaps a strong family history, or an increased susceptibility to genetic mutations. So probably the vast majority of my patients are actively undergoing chemotherapy, radiation, getting ready for surgery, undergoing immunotherapy, endocrine therapy, or recovering from each of these different therapies. We have very complex patients. They're wonderful, and they have a lot that they're dealing with, and so we have to be really present with them. Our residents are given an allowance for continuing education. They're encouraged to attend various conferences, whether that's OnCANP, WANP, the Society for Integrative Oncology, as well as other local oncology educational events. Okay, I guess that's all. If anybody has any questions, please feel free to reach out to us. info@seattlend.com is a great email to contact us. Thank you so much.
Thank you very much. Koa Clinic, please.
Oh, sorry, can you hear me?
Yes.
Okay, hi, good morning. I'm Dr. Corinne DeSoto. It is still morning here in beautiful Kailua Kona on the Big Island of Hawaii. That is a photo of our lovely little town. And yes, we do get rainbows like that on a regular basis. The Koa Clinic is an integrative clinic. There's myself, a naturopathic physician. We have a Chinese medicine provider, a nurse practitioner, a PA, and we are onboarding an MD gynecologist right now as well. We are a really close-knit team and we collaborate together on many patients. We have monthly grand rounds and many social events together as well. We are a really close team. We do provide about 60% insurance covered primary care. Our clinic does accept all forms of insurance, including Medicare and Medicaid, although even though naturopathic doctors themselves are not covered by Medicare. We do see patients of all ages, sex, and gender. My youngest patients actually on my schedule this week are 1-week-old twin babies, and my current oldest patient is 99. Although we do have a women's health focus, and that will be developing further as the gynecologist gets onboarded with us this year. In addition to our primary care practice, we do have a variety of cash-based services. We have a hyperbaric oxygen chamber, IV therapy. We do have a membership-based practice as well. And a lot of patients come to us for complex chronic illness as well as primary care. And we are also providing some group programs. We've just been running this last year with a grant, a postpartum group that focus on lactation and postpartum care. And we are trying to develop more and more group programs as well. So thank you. So this is a newer residency site. The next resident would become our second resident. So as such, you will get to have sort of a hands-on say and what interests you. We can tailor it to you. We do collaborate with a lot of other providers in the community. As I mentioned, we have a lactation consultant. We collaborate with a midwife, physical therapist, other naturopathic doctors who specialize in the community as well. It is a very community-based residency, and the primary care aspect of it will be the focus, at least at the beginning of the residency as well. As I mentioned, you will be doing a lot of direct one-on-one shadowing with myself, but also the other providers in our clinic as well. So it's a pretty well-rounded education. We are also actively working on trying to grow and provide more support for our community. We do also offer, as you can see there, the salary and other benefits. We do also care a lot about your work-life balance. We try not to overwork you because, we recognize how important it is to also get out in nature and enjoy the beautiful island that we live on. Okay, so who should apply? People who have a strong interest in community health and primary care. We are a very underserved community out here in the state of Hawaii, and especially on the Big Island. We're on a literal and figurative island in terms of healthcare. So while we do, of course, refer to specialists, sometimes there is a very big delay or just there's no ability to see a specialist of a certain type. And so we often are having to do a lot of legwork for our patients to try and get them the care that they need. We are looking for applicants who are very specifically interested in improving the community that they live in. So we do participate in health fairs. We are looking to build strong relationships with other provider in the community and hoping that the resident will help facilitate that for us as our clinic, but also for our community overall as well. Of course, living in Hawaii is an incredible privilege and honor, and while you will get plenty of time to surf, swim, paddleboard, hike, etc., we also expect that our residents will learn about local culture, language, and customs in order to provide more culturally appropriate care, but also live in respect to the Hawaiian people. We do hope that you come out and visit us. This is not an ad for Hawaiian Airlines, so please come see us, see our island, see our clinic. You can reach out to our clinic to coordinate those visits, but also I provided the email address for our current resident here if you have any questions that you want to ask, and thank you so much.
Thank you.
I'm Dr. Maya Roth. I'm the residency director at Bastyr, San Diego, and we're looking to hire 2 first-year residents. The salary is north of $68,000. Residents are typically assigned to 7 weekly rotations. They have an opportunity to work with providers on biofeedback, intravenous therapies, physical medicine and hydrotherapy, autoimmune, homeopathy, and counseling shifts. They also have an opportunity to go to remote training sites, such as urgent and primary care site, Indian Health Council site, collaborative wellness collaborative site, and excellence in justice and education partnership. Residents are also have an opportunity to have 1 independent patient care shift, one-on-one, and 1 student supervision shift. We're really looking for someone who is passionate about mentoring students, teaching students. We're very interested in someone who is interested in practice management, community outreach. And I want to give the rest of my time to Dr. Ksenia Zvereva, who is the second-year resident at Bastyr, San Diego.
Thanks, Dr. Roth. Hi, everyone. I'm doing my second-year residency, as Dr. Roth said, at Bastyr University, California. Okay, I'm going to give you some highlights of this residency that I think will help you make the decision to come here. So one thing that I was really looking for is a breadth of modalities, which I think Bastyr University, California has, as you can see on shift here or on the slide. So we have open labs where you can practice different modalities, but we have specifically research shift. We have specific homeopathy. We have a pilot hydrotherapy shift where all we do is hydrotherapy on the shift. We have practitioners who are IFM trained, if that's something that you're interested in. And we have a lot of tools. Being part of a bigger university allows you the possibility to have all those tools. So for example, ultrasound, lasers. And then as Dr. Roth mentioned, being able to work collaboratively with urgent care can give you that experience if that's something that you're interested in. I primarily chose this residency because I'm passionate about teaching, and teaching helps me become a better provider. And so I have, as a second-year resident, I have 2 team care shifts, but as a first-year resident, you'll start off with 1 team care shift and basically be able to lead students in seeing patients and give them feedback on their treatment plans and their charting and their history taking. And then in terms of Journal Club, Journal Club is a weekly meeting. So the weekly things that happen is Journal Club is where we basically discuss various research articles that we as the students found, and then we present on them, and then we get to discuss that. So that's been really helpful. I also have weekly meetings with Dr. Roth, who is the residency director, who can answer questions anywhere from my patient has a high blood pressure to, I'm having problems with a student. So that's been really helpful. And then being part of a also bigger university basically allows you to have full access to libraries. So I have in my office, I have all of these books that I have access to literally at the reach of a hand. So I see time is up. Happy to answer any questions for anyone that's interested in a residency that's academic in nature.
Thank you so much. NUNM.
Great, thank you so much. I'm Dr. Dee Saunders, and I am the residency director at NUNM, and I'm accompanied here by our assistant residency director, Dr. Bohem, who's going to do the second 2 slides. So I'm just going to work quickly through mine. So if you could go to the image really quick, this image, sorry, the previous slide, back to the previous slide. This image was really kind of put together to demonstrate our diverse patient population and also our team, the fact that our residency is centered around having multiple mentors. Our academic environment gives us access to many different modalities and experiences, and we just have a really amazing and fun team. You can read more about these things in the job description when it's posted, but ultimately, NUNM is a primary care home. We do quite a bit of adjunctive care as well. A primary care home means we have a diverse population of patients across all age ranges, from child wellness visits all the way up through the management of chronic disease. We have shifts that approach chronic pain, cancer. We do a lot with LGBTQIA health and gender affirming care. One of the highlights on this page really is our resident education 3-hour seminar every week. Our topics, there that are listed are teaching clinical reasoning, health disparities, journal club, medical decision-making, and M&Ms, morbidity and mortality. What I don't have on here is we are a 503 nonprofit, which means your time counts towards public loan forgiveness. If that is a goal for you, to be working in nonprofit and continuing to serve diverse and underserved populations. Next slide, I'm going to turn it over to the Assistant Residency Director, Dr. Bohem.
Thanks, Dr. Saunders. I loved my 3-year residency so much, I decided to stay on. Like Dr. Saunders said, I'm now the Assistant Residency Director. What you can expect to gain from an NUNM residency will be refining your clinical expertise, and that's in a wide array of things that we see because we are a student teaching clinic. You get to work on the cardiology shift and the minor surgery shift, IV therapy, etc. You can also expect to enhance your knowledge in different naturopathic modalities. We also have hydrotherapy shifts, which are first-year residents. That's their opportunity that they get to lead that shift on their own. You can strengthen your critical triage skills. We have a 24-hour on-call service it's an on-call phone that the residents get to swap out every week. And so it gives you the opportunity to think on your feet. And you can also grow your professional awareness within this residency. So why do an academic residency? We're looking for people who love to teach. If you think about yourself when you were a student, did you also find yourself, I guess all of you are still students, do you also find yourself tutoring your peers or tutoring people in grades below you? Those are the kind of people that we want to see here. So who are you? You're someone who learns by teaching, likes to teach. You want to see a wide range of cases. You want to be able to work with people who are doing gynecology, placing IUDs, maybe minor surgery. The list goes on and on. We also have a really amazing team. I think the community at NUNM is my favorite part of it. We do monthly bondings between all the residents. I'm actually hanging out with 2 of my former resident friends this afternoon. You also get a very healthy work-life balance. You're 90 minutes from the mountain, you're 90 minutes from the coast. So if you like to be outdoors, it's a great place for you. And like Dr. Saunders mentioned, being a resident at NUNM qualifies you for public student loan forgiveness. So that means you can have your loans forgiven after 10 years instead of 20 or 30. Dr. Saunders, did I miss anything you wanted to touch on? Okay.
Nope, thank you. And I see we're at time. So thank you very much. Please chat us or email us if you have any questions or would like to come preceptor on a shift.
Dr.
Hello, everyone. My name is Dr. Jasmine Carino. I am the Associate Dean of Curriculum and the Residency Program at CCNM. And what I wanted to do is talk to you about the Canadian College of Naturopathic Medicine residencies. And I have three different types, but they're all academic in nature. One or two of them exists in Toronto, Ontario, Canada, and one exists in Vancouver, Canada. So if you are Canadian or if you're interested in a Canadian residency, I want you to consider those residencies, as well as if you're interested in an academic residency. You've already heard some really wonderful benefits of the academic residencies, and part of it is the academic activity that you're participating in. What you can see is that you are acting as a professional instructor in many ways, as a teaching assistant, small group facilitator, and sometimes an instructor or a guest lecturer, if you will, for a couple of classes. And this is mentored by our faculty over at CCNM. And as you can imagine, the see one, do one, teach one really gives us an opportunity to provide people with an opportunity to gain their expertise and their experience. As part of the residency, you are working with the research director within the college to help complete a research project, as well as you have some continuing ed, extended healthcare plan, as well as continuing ed information. Just a few things about the residencies. In Toronto, we have a 2-year residency, and of course, you're assisting in the clinical training and supervising of interns, but what's really fantastic about these residencies is the diversity of patients that you see as a supervisor, but also as a private practice practitioner, because you will have an opportunity to work for half a day in first year and then a full day in a private clinical practice of your choice, so that you can build up that repertoire. Just a couple of other things. You will require to complete the College of Naturopaths of Ontario entry to practice exams, and you will also require some background in acupuncture TCM, which is 220 hours. Over at Boucher, this is the one in Vancouver, it's a 1-year renewable. So it's 1 year, and you'll be working very similarly like over in Toronto campus, assisting in the clinical training as well as the academic education of naturopathic students, as well as developing and maintaining a private clinical practice. In Vancouver, you'll require to pass your NPLEX 1 and NPLEX 2. And the final one, which will be highlighted in this next slide, is the Integrative Cancer Center Shift, or that residency, which is a 2-year program on Toronto campus. This is ABNO approved, and you can see that we have hospital oncology rotations, and you will be supporting the teaching clinic there. So that is all the information I have for you. Thank you very much.
So thank you all for coming today. For more information, please screenshot this slide. We will also be sending this out in the near future. So next event is December 7th, and we also have a general ANMC webinar in December as well. And then the second phase of the Q&A happens on January 26th. But however, if you have any questions along the way, please feel free to email us at residency@aanmc.org, and we'll be able to hopefully connect with you. And thank you so very much for coming today. Appreciate everybody, both sites and resident applicants.